Well, thank you, Suzanne. I'm delighted to be here and talk about this interesting topic, which was framed as can you catch cancer, and then to talk about viruses and cancer. This is a picture of my granddaughter Isabel. She's almost 2, and I show you that picture because I want to tell a story to start off with. A few years ago in my clinic, I had a woman in her 60s who had breast cancer. And she was one of those rather charming women that seemed, I think, to go through life taking everything in her stride. And so when she received a cancer diagnosis, she took that in her stride as well. And she seemed to be going quite well with the treatment. And one day she came into my room and she was clearly upset about something, and I asked her what it was, and she said, well, over the weekend I went to visit my daughter and granddaughters, and my daughter had forbidden the grandkids to hug me in case they caught cancer. And although I know it was done for all the right reasons, the fact was that was one of the cruelest things you could imagine, just at a time when someone with cancer wants a bit of human contact and can greatly benefit by it. And it was a totally false reasoning by the daughter about whether she could, by casual contact, pass cancer on to her grandkids. And I guess since I've had grandchildren, I perhaps only realise over the last couple of years how difficult that must have been. So in giving a talk, Can You Catch Cancer?, the first thing I have to say in the take-home message will be what I'm going to talk about is not catching it by casual contact of hugging people and so on. Most of the ones we'll talk about are things like sexually transmitted diseases. There's no doubt that cancer can be associated with viruses, but they're very specific situations. So we don't want to repeat the misfortune that happened to my patient. So here are a list of cancers and viruses that cause them. And I'm going to talk to you about the human papillomavirus because if you haven't been infected by the human papillomavirus, you can't actually get cancer of the cervix. The same thing occurs with a virus, and the other cancer is liver cancer and the hepatitis B and C viruses. Now, they don't all go on to liver cancer, but if you have chronic hepatitis B, it can actually eventually come to become liver cancer. So that gives you a clue that if we could control Hep B and Hep C, we'd be able to do something about the incidence of liver cancer. Both of those in Australia are quite uncommon cancers. And then as we go down the list, we have something that was at least of historical interest, and that's Kaposi Sarcoma, which was essentially the cancer that alerted people to the fact that there was a funny disease occurring when they discovered AIDS and its relationship to a virus. And so although they thought the AIDS virus was what had caused it, it was actually something else in the end. Nonetheless, it made a link between a sort of an infectious disease and cancer. And then there are some rare ones that I'm not going to spend a lot of time talking about, but you will have heard of the Epstein-Barr Virus because it's often associated with glandular fever in our community. But in Africa, where it's endemic, they can get a very rapidly growing form of lymphoma in children with large lumps in the neck. And I was going to show you a picture, but it is a lunchtime lecture, so I thought I wouldn't do it. But rapidly progressive lymphoma in children. And then an even rare thing called a Merkel cell cancer, which occurs on the skin but is quite aggressive, and that's been associated with a virus as well. So they're the major ones in terms of the viruses, but they're really the top 3. And if you look at the percentage there, even the most common cancer that's associated with a virus is only about 5% of our cancer, and the top 2 perhaps, and the rest go rapidly downwards from there. Now, I don't want to talk down to people that know a bit about viruses and cancer, but I don't want to lose anyone either. So the next couple of slides are very simple. What is a virus? A virus is a tiny particle. It's 1/100th the size of a bacteria, which in turn is 1/10th the size of a human cell, which in turn is 1/10th smaller than a hair. So a virus is a very tiny particle. And all it is a little bit of genetic material, DNA or RNA, that's wrapped up in a protein coat. And some of them just have the protein coat. They're called naked viruses, but some of them wear an overcoat of lipid, and it makes up the whole little package. And that's all a virus is. It can't replicate. It's got no machinery. It is just a bit of genetic material wrapped up in a coat. How do they reproduce then? Well, they use the cell's machinery to reproduce. They find a suitable cell to attach to, and each virus seems to like a particular cell. I mean, the flu virus obviously goes to the chest. They get into the cell, and then they use the cell's machinery that the cell usually uses for reproducing its genetic material to reproduce the virus genetic material. And when that's done, it breaks out of the cell, kills the cell, and a whole lot of viruses go to the next cell, and so you can really get a head of steam up in reproducing yourself using the machinery of the cell that you've infected. So that's a virus. Well, what is cancer? Well, in its very simplest form, cancer is a change in the genetic material in the centre of a cell, often called a mutation, but mutation just means change. So one of the bits of genetic material gets altered, and so the alteration means that the cell grows out of the normal control and just replicates and invades the surrounding tissue and spreads to distant sites. So you can see how these two are going to interact in a minute. One needs to use the cell's machinery. The other, if you change the genetic material, you can trigger off cancer. So what happens is that the tumour virus, a virus that can cause cancer, actually infects the cell. And in trying to use the cell's ability to replicate, it actually inserts its own bit of DNA into the cell. And that actually causes the cell to grow out of control if it's a cancer-causing virus. Most of them aren't, but some of them are. And so unlike other virus infections, what this does is instead of killing the cell and just replicating the virus, it inserts itself. It makes the cell replicate out of control with its new little bit of genetic material in it. And so it just keeps growing, the cell keeps growing rather than the virus. And because it's the infected cell isn't subject to the same pathways as the body cell for regulating growth, you just get this cell growing and growing and growing and pushing out the normal tissues. So what about the sort of history of how did people come across the idea that viruses may be related to cancer? Well, you know, in the old days, of course, infectious diseases were the diseases of the moment. And so when diseases like cancer came around, there was always a question as to whether it could be some special type of infection that was causing cancer. But back in 1981 in the United States, a couple of strange things happened, and the people that monitor diseases were noting two things. They were noting that people, young men particularly, were getting a rare type of pneumonia called pneumocystis carinii pneumonia. In prior years, it had only been for people who were known to be immunosuppressed, and suddenly young men were getting it in far greater quantities. Once upon a time it was a very rare presentation, and now it was becoming more common. But the other thing they were noticing is this disease called Kaposi Sarcoma, which has really usually manifested itself as purple spots on the skin. And in its older form, its classic form, it was usually found in old European men, and it was a fairly indolent sort of thing. You know, they had purple spots on their legs, but it wasn't particularly life-threatening. And what they were finding in America was these young men were getting these purple spots not only on their legs, they were getting it right down the lining of the mouth and the stomach, and they were occurring on the face, and they were rapidly growing. So there was something odd that had happened to this very slow-growing disease that said there's a new disease here, something's happening. Well, the new disease was actually AIDS. And it wasn't long before it was discovered that AIDS was due to a virus, the HIV infection. And the young men who were getting it were largely gay men and drug addicts. And what was found was that the virus was suppressing their immune systems, and so these strange infections and this rather rampant form of what used to be quite an indolent disease, Kaposi Sarcoma, was being seen in these people. So it was the clinical manifestation that first alerted people that there was some sort of disease going on, and then they worked backwards from there. And so initially it was thought that it was the HIV infection that caused AIDS that actually possibly triggered Kaposi Sarcoma. And I just make the point that just because you find an association between one thing and another doesn't mean that one thing causes the other. And we have this all the time. And, you hear a press report that underarm deodorant causes breast cancer only because there's a group of women with breast cancer who've been using underarm deodorant. The fact is, it doesn't cause breast cancer, and just the association doesn't allow you to make that causal jump. Well, here they did the same thing. They said HIV virus must cause Kaposi sarcoma. In fact, it was actually caused by a type of herpes virus that because they were immunosuppressed, they were catching, which they hadn't before, just like they were catching the rare form of pneumocystis pneumonia. So it was the fact that the virus was getting to their immune systems that allowed these things to happen. And eventually, some years later, back not until 1994, was it discovered that the actual virus associated with Kaposi sarcoma was in fact a herpes virus and not HIV. And this disease could be treated with chemotherapy and radiotherapy like other diseases, and it's a herpes virus-related cancer. So that's the historical stuff, and that's the sort of rare stuff. I now want to get on to the common stuff, and clearly in Australia, one of the things that most people are very aware of is the link between the human papillomavirus and cancer of the cervix, and with Ian Fraser having won the Australian of the Year for his role in the development of the antiviral vaccine against HPV that eventually is going to lead to cancer of the cervix either becoming a very, very rare disease or maybe one day being wiped out altogether. Now, Australia, as it happened, had a fairly low rate of cancer of the cervix compared to other cancers. There were only 770 new cases and a couple of hundred deaths that were being reported 2 or 3 years ago, which was the last time we had complete figures. And what had been known, though, the reason it had been so low was the screening program with Pap Smear was actually working very well. And we'd seen the incidence of cancer of the cervix decrease from 19 cases per 100,000 in 82 down to 9 cases by the time you got to 2007. So the Pap Smear program was picking up precancerous lesions or very early cancers. They were being successfully treated and no one was getting, or very few people were getting invasive cancer of the cervix. And because, as well as the incidence decreasing, the mortality was decreasing as well, and we were down to 1.9 deaths per 100,000 from 5.5. So basically, since the Pap Smear program, the screening program, was introduced in 1991, our incidence of cancer of the cervix has halved. So on top of that, we now have a vaccine that both schoolgirls and schoolboys are getting, and that should knock that figure down by another 70% if we had complete vaccination. And once we get a vaccine, and the reason we'll only do it by 70% is that it only covers, one of the vaccines covers 2 and the other covers 4 of the subtypes that cause cancer of the cervix. If we covered all the subtypes, we may well be able to eliminate the disease altogether as long as everyone agrees to be vaccinated. And, that's quite different from the world figures where in Africa, Central America, it's, one of the major causes of death. We had 1.5 and they have 35 per 100,000 in Eastern Africa. In fact, just to our north, I was in Papua New Guinea a few weeks ago, and just to our north, it's the major cause of death in women. So geographically, the vaccine has the potential of saving millions of lives. Pap Smear had been used since the 60s, but it started in earnest with a well-structured program in 1991. The screening involves starting when women are sexually active and smearing every 2 years. The participation rate isn't as good as you'd like at 57%. We'd like it up closer to 70. We'd like it at 100, but that sort of never happens. So 70 would be a good target. And in fact, because of the vaccine, eventually the Pap Smear program will become history. But for the moment, because the vaccine only covers about 70%, you've got to keep going with the Pap Smear program. Now, maybe it can be altered. It appears that a 3-year interval will be as good as a 2-year interval, and it may be that you can start later because now we know you need the virus for a few years before you get the cancer. Maybe you could start in the mid-20s. So we're going to actually modify this, and maybe instead of doing the Pap Smear that looks at the cells in the cervix, maybe we just should do a test that looks for the virus, because if you don't have the virus, you can't have the cancer, and that will change the whole screening program. But it's an example of a very successful program, and even if we move to testing for the virus every 5 years, we're going to have a good chance with the vaccine of wiping out this disease. So the knowledge that the virus, HPV, caused cancer led to 2 major changes. One was that you could have an antiviral vaccine that would prevent a cancer. So this isn't an anti-cancer vaccine, it's a vaccine against the virus, but you need the virus to get cancer. And then, having developed the vaccine, there was a national screening program, and now that we have both girls and boys vaccinated, it means the amount of virus in the community will decrease, so everyone will be less exposed to this virus. The fact is that many people that get infected with HPV, it just spontaneously clears. So it's not by all means that, if you get it, you're going to get cancer. You're certainly not. But the point is it's a necessary condition for getting cancer. And it's usually figured that it takes about 10 years between infection and when you get the changes that go on to cancer. So it's not a rapid change at all, but this virus is quite common in the community. So Ian Fraser developed the vaccine. We know now, because the program's been going that long, that it continues working for at least 8 years. It'll probably continue working for life. One of the vaccines covers 2 of the common causes, the other 4. And even just a few years after introducing the vaccine, we've already been able to measure a significant decrease in genital warts and vaccine infection that will mean certainly that will translate to a decrease in cancer of the cervix in the coming years. It doesn't work if you're already infected, so it's not a treatment vaccine itself. The uptake is about 70% at the moment. We'd like it higher, but that seems to be what you can expect from a screening program. It's particularly going to be helpful in our Indigenous population because they actually die 4 times as often from cancer of the cervix as the rest of the population. So if we're going to vaccinate anyone, we must make sure that group in our community are vaccinated. And the introduction in boys in 2013 to add to the girls being vaccinated in 2007 was really important. The boys can get warts. They can get a form of head and neck cancer that's related to being infected with human papillomavirus, but the big effect will add to the effect in girls that haven't been vaccinated because they won't have as much virus to be exposed to in the community. So it decreases the amount of virus in the community, or what they call decreasing the herd or increasing the herd immunity to the vaccine. So that's cancer of the cervix. That's the big story about viruses in cancer. The reason you need to know about it is we can prevent it, and it may well be wiped out in many of your lifetimes. So now we'll move on to the second one, and that's the hepatitis virus and cancer of the liver. Now, chronic hepatitis B and C are very clear risk factors, and this is a big problem across the world. 380 million people are estimated to be affected with hepatitis B, and if you are infected, you've got about 100 times the risk of developing liver cancer than if you're not infected, and although many people remain infected for years, somewhere between 2 and 6% do progress, and they first go on to cirrhosis and then develop the liver cancer. And with hepatitis C, there's 170 million cases worldwide. It increases your risk of liver cancer about 20 times, and about 5% of them, although you can have this chronic infection, will eventually get cirrhosis and therefore at great risk of getting liver cancer. And on those two maps, the green and the red show you the incidence of Hep B in the green and Hep C in the red, and you see that Southeast Asia and Africa are the big sources of infection. So in Australia, the groups that are largely affected are people that migrate from those countries, and unfortunately in Indigenous Australians the rate is higher than the rest of the population as well. So if you wanted to do anything or screen or do anything, they're the target groups, not the whole population. They're the groups that are most likely to have the cancer. How do you get Hep B? Well, around the world, the most common transmission is simply from mother to child. So that in areas, in countries where Hep B is all over the place, the mother passes it on to her children. Although the other way of getting it is through unprotected sexual contact. It is a sexually transmitted disease, and the third major way is by sharing needles with intravenous drug users and getting the infection that way, or being exposed to contaminated blood. But I have to say, in countries like Australia, the blood supply is protected fairly well from infectious diseases. And the problem is that it can go on to cause liver cancer. And in fact, in Australia, probably about 80% of the liver cancer we see is related to prior infection with Hep B and Hep C. And the big myth that used to occur was if you got Hep B and you didn't get any illness and you were just a carrier, you'd be all right. But that's not the case. Chronic infection with Hep B could eventually catch up with you, even if you didn't get the acute hepatitic illness. And I think that's an important factor. So what about liver cancer? Again, a rare cancer. When I talk about, not getting this with casual contact, this is a rare cancer. 1,300 people were diagnosed in the last time we had the population figures for Australia. 1,300 people diagnosed with primary liver cancer. It caused almost the same number of deaths, which shows you that it's a pretty difficult disease to treat, but it's only 2.8% of the cancer deaths in Australia. As I said, you can pick the countries where it's going to be highest. It's migrants from Asia and Western Africa, and the Indigenous Australians have 5 to 10 times the incidence of hepatocellular cancer and are 12 times more likely to die of it because they have more Hep B infection. And this is just a survey done in New South Wales of some of the migrants from the countries where you'd expect to get this disease, and they have quite a high percentage of them that are Hep B positive. And that's quite different from the rest of the world. I just wanted to show you the figures to say that, in Africa, probably the Hep B virus is 60%. In Europe, it's different as well. So whether this virus is around and whether it causes cancer differs all over the world. There is a vaccine for hepatitis B, and that's why we need to know about it, because you can do something about it. The vaccine has been available since 1982, and the complete hepatitis B vaccine induces antibody levels that protect you against it in more than 95% of infants, children and young adults. So if you're vaccinated, and a lot of people get vaccinated before they go overseas, you're probably going to be okay as long as you haven't had Hep B. The problem is, as you get older, the chance of the vaccine sort of taking, if you like, is a lot less. So by the age of 60, protection drops to about 65 or 75%, so you mightn't be as well protected. So if you're going to have your Hep B vaccine, which I think you should have, you should do it earlier rather than later, and eventually it'll be part of the routine vaccinations in schools, and this is a disease that we'll see less of, and we'll see less liver cancer as a result of that. So if we wanted to use this method, and given that 80% of Australia's liver cancer is due to this, neonatal vaccine has been shown to be the most effective. That's when your immune system is most likely with the newborn child to be able to have a full response. But you can, and often we do, vaccinate adults, particularly as part of travel vaccine. We have to ensure a safe blood supply by testing and making sure we take good histories of the donors. We use what we call in hospitals these days universal precautions. Instead of isolating people and saying, you're a carrier of this or you could be a carrier of this, you treat everyone like they've got an infectious disease. Which really just means you wash your hands after you've examined everyone and before you've examined everyone, and a simple means like that can often make the difference between transmitting a virus and not. But it's a difficult message to get across. So universal precautions have meant that everyone should be treated as if they're infected, and of course we've got to try and reduce the amount of illegal drug use and particularly injections in an unsafe environment where people share needles and just simply share the infections that cause it. So we can prevent liver cancer, but what about those people that have already got our Hep B, the groups that have migrated in, others that have got Hep B? What can you do? Well, should you screen everyone to find out which they were? And in general terms, that would be putting most of the population through a screening test that they didn't need. So we've got to figure out who should we screen, because if you've got a chronic Hep B infection, there are treatments for it, and you may be able to stop that progression to cirrhosis and cancer. So there are antiviral therapies that, for these high-risk groups, we can control HPV and eradicate Hep C infection, and that's what we need to do, which will in turn prevent liver cancer. And this is a list, this is actually from the US because they're actually further ahead than we are at this. They've got screening recommendations, but this is just really a list of high-risk people. So people born where you know that Hep B is all over the place, and I've shown you the map of that. Men who have sex with men, injection, people who share their needles, and so on and so on. So you just screen the high-risk population and then you treat them with the drugs that are available for hepatitis B. And the drugs were interferons, and then there's a whole lot of antiviral agents that actually prevent the virus from replicating in the cells. And many of them are now on the PBS in Australia, and so they are easily available to people who have these infections. Hep C, unfortunately, doesn't have a vaccine, so antiviral therapy remains the best strategy, and just as late as February this year, a couple of anti-Hep C treatments, if you've infected with Hep C, became available and were put on the PBS. So we should be able to treat the high-risk groups and vaccinate everyone else against Hep B. Now, I was asked to talk about viruses in cancer, but just to put it into context, and particularly because I'm in Western Australia, viruses aren't the only infectious causes of cancer. And you know, bacteria have been associated with cancer as well. And the best example was a chronic infection of the lining of the stomach with a bacteria called Helicobacter pylori. And its association with stomach cancer, when it was first postulated, was thought to be absolute nonsense. But the people that postulated kept at it till they'd proven the association, and those two people were Barry Marshall and Robin Warren, who now are holders of the Nobel Prize for a discovery that will allow you to treat the Helicobacter infection to try and prevent people going on to get the stomach cancer. So it's not only viruses. A bacteria, an infectious agent, can cause cancer, and Western Australia led that work. Just to complete the picture, parasites can also cause cancer as well, and in countries that have a lot of parasitic infection, particularly, you know, puddling around water in rice paddies and getting the parasite, catching it, and some parasites can cause, for example, a rare form of bladder cancer if they infect you, and the worm's eggs seem to trigger off the cancer. And there's also another rare parasite that's found in Asia that can be associated with bowel cancer, and of course liver flukes have been associated with cancer of the bile ducts as well. So it's not only that viruses can cause cancer, that's the common ones we've talked about, but bacteria and parasites can as well. So are we going to see any more vaccines against cancer? Because that would be ideal. If we can vaccinate people against them, that would be fine. The question really is, what about more antiviral vaccines? Because remember, antiviral vaccines aren't anti-cancer vaccines. They're just taking advantage of the fact you need the virus before you get the cancer. Well, it turns out that human papillomavirus is also possibly associated with some types of non-melanoma skin cancer. And so Ian Fraser's working on that association, and we may be able to develop a vaccine for skin cancer. That may be the next antiviral vaccine that knocks out a cancer. And so it's quite exciting work that we should hear about in the next few years. But the story isn't complete just with the association of viruses with getting cancer and therefore being able to prevent it, because viruses are increasingly being thought of as agents to treat a cancer. And viruses could do this by two means. I mean, if they're responsible for inserting things into cells, usually their own DNA so it gets replicated, could you put something in a virus that you wanted inserted, like a replacement gene for a defective one, to try and stop cancer? And the answer is that's exactly what people are trying to do. They're using viruses to introduce new genes into cancer cells to replace the defective ones. So viruses may have a role in the treatment of cancer. And for example, but the other thing they can do, because viruses generate immune responses, what about if you wanted to generate an immune response against cancer? Well, it turns out you can infect some of the body's immune cells to make them able to recognise a cancer and attack it, and that work's been done mainly in melanoma. Gene therapy, as I've just said, can be used as well. Viruses can be used in gene therapy, because how do you get the new gene in? Well, you use all the mechanisms that a virus knows about to get itself in, to get the new gene in. And just to show you that the talk's up to date, this article appeared in the Brisbane Sunday Mail yesterday, and it's out of a group who's working in collaboration between Adelaide and the United States. And what they've got is they've got a leukemia virus. And what they've done with this leukemia virus is they've infected the body's immune cells called T cells. They're lymphocytes. They're white blood cells that are usually part of the body's immune system. And they've infected these T cells so that they'll recognise melanoma when they see it and start attacking it. So they're priming the body's own immune system using a virus to prime the body's own immune system to knock over melanoma. Now, it's been very successful in mice, and the next step is to put it into humans, but that's where they're up to in this research. So we're not only having viruses causing cancer, we're going to start using viruses to treat cancer as well. My talk's also up to date because I had my second granddaughter 5 days ago, and this is Annika. And I only show you that picture to reinforce my first message. Yes, viruses, bacteria and parasites can cause cancer. No, you can't catch cancer by casual contact. So for heaven's sake, allow anyone with cancer to cuddle their grandchildren. Thank you.